Hi, I'm Stephanie Buddy, and I'm going to be doing the IV insertion today. First, I'd make sure I have all my supplies. And I would make sure I would follow the doctor's order to make sure I was supposed to be doing this and what I was doing it for. And he would have clean arms and hands. I'm just going to demonstrate how I'd find a vein on his arm. Have that tight, and I'd look for a good vein. You can roll his hand a little bit. Looks like there'd be a good one right here. Then you would take the tourniquet off and remember where it is, and then you would start to clean it. And now I'm going to do the rest of my demonstration on the banana. You can go. I'm going to start to open all my supplies. And I've washed my hands. You want to try and keep a clean field. It's not as sterile, but you want to try and keep it as clean and sterile as possible, if you can. And you want to have everything ready for when you're doing this. A nurse is only allowed 2 tries. After 2 tries, you need to find another nurse to help you with the procedure. You don't want to be hurting the patient. You just want to make sure you're letting the patient know what you're doing and how you're doing the procedure and why. If you were doing the blood like on the demo, you'd have an 18 gauge needle. My needle is a 22 because that's all I had available to me. Just to help out with the procedure, I'm going to first prime my tubing. Just want to make sure it's primed with a little bit of fluid in there. Once that's primed, try and keep that clean as well. And you're going to break open the ChloraPrep. And you want to clean a slightly big area in case you do need to re-poke. So here I clean an area. I'll make sure you clean a big enough one just in case. And after you've got it clean, just to refine the area, you would reapply the tourniquet and go about 6 inches below, or you put the tourniquet about 6 inches above the site. And I'm going to take the needle. 1 second here. I'm going to put some gloves on here. For this part. My gloves I do have are sterile gloves, but I'm going to use them as regular since you don't need sterile. Just want to keep it as clean of a procedure as you possibly can. Remove the cap. You can see here. And you're going to hold the skin taut. And insert the needle, not straight down. And then you're going to wait for a blood return. As you have a blood return, you can clamp this off. And as soon as that and you can apply gauze for underneath. And you do need to tape it down here. You want to tape that down for security. You're right on top of the bevel here, and the blue part. You want to tape that down, and then you also do want to tape this. You would disconnect the saline lock after you administer 2 milliliters into the IV to make sure it is patent. Then you would tape, you'd undo that and hook up your IV. You would tape this area secure. You are going to put a Tegaderm also on the area. Not too high up. At this point you can remove the gauze. That was just if you spilt. You want to get on their skin. You can remove that. And make sure you do label and date the site here and the date of you doing it. So put 11/12. When you would be done, you would document how it went, what size gauge, if everything came out okay, the blood return, how the patient tolerated it, and what they'd be on. You also want to know how long it's going to be in. If it's 7 days, or if this is just going to be a temporary thing just so they can get the blood. You need to know that. You just want to make sure the patient is secure. You also make sure you do it on a hand, that it's not their dominant hand. If you can, do it on the other hand. And you also don't want to do it on the hand that they had a stroke or a mastectomy or anything like that. You want to do it on the opposite side of the body. Thank you, and that was my IV insertion.